Hey everybody, this is Beast. Welcome back to my channel. My name is ScottyAllenDay. Over the last few months, I have researched and read about our rising cost of healthcare. Mainly because I pay over $900 a month for my wife. My company covers mine. I have also read on how many people don't have medical care. And I've also learned enough to say that there's a way to be able to reduce the cost of health insurance. And it's on my top 10 list today. I have my notes here. So basically, I came up with a top 10 list of how we can actually reduce healthcare, or maybe. I don't know if there's even a light at the end of the tunnel. I don't know if it's gonna rise, and you can never be able to afford quality health insurance. But you know what? I wanted to kind of break the ice. So I'm gonna tell you off my top 10. If you see something that you like, if you see something that you understand, or you want to interject with something that I tell you, please drop it in the comment section below. This is something brand new. I want to write this all out and put it into my archives, because I would like to tackle this a little bit later on. This is a very premature top 10 list. I don't know if some of these could even be possible. Some of these could even be, you know, even be imaginable. So I appreciate you guys watching the video. I appreciate you commenting on the video, liking and sharing the video. But without further ado, let's get started. So number 10 is going to be eating more natural foods instead of processed foods. So lately, when I've been doing a lot of research for my weight loss, I'm going to the gym, doing better for myself, I've been reading a lot about processed foods, and I was shocked about how many of these fast food or even just moderate restaurants that would buy ham, but it's not ham, it's turkey. It's turkey ham. It's ham. It's made out of turkey, and it's flavor injected, and it's glazed and everything that looks like ham. It looks and tastes and smells like ham, but it's really turkey. And I'm like, wait, huh? And then I started reading about the cheese, which is 99% vegetable oil. No wonder you go in the Hershey squirt in the restroom after eating this type of stuff. And how some of the salami and bologna that people are buying, and the meat is so processed that it has absolutely nothing in it. Or some of these discount grocers that the meat is very, very pink when it's supposed to be dark red and marble. And you know that the processed foods is causing more damage internally than anybody even says. So I would say just switching to more natural foods instead of processed foods, and cooking more at home. This one's a big if. This is very controversial. This is something that, you know, but cutting drug dependency by 50%. Just 50% would probably drop medical insurance costs. So, and I'm not talking about street drugs. I'm not talking about the fentanyl street drugs. I'm not talking about cocaine. I'm not talking about marijuana. I'm not talking about heroin. I'm talking about even over-the-counter or prescription drugs. If we can cut our dependency by 50% off of these drugs, I can guarantee you health insurance will go down. Why, I couldn't tell you, but maybe because of the side effects. Because you have to go and, if you're getting a prescription drug and you're constantly going back and forth to the doctor so they can be able to test you to make sure that the drug's doing right. So you're using up office visit times. You're taking a drug. And it kind of reminds me that when I had some really bad leg ulcers, and the doctor prescribed me 2 different drugs. They prescribed me with water pills and something else. And so I said, okay, well, I'll take them. And it made it worse. And I tried them for 6 months. I gave them 6 months, and it just made it absolutely worse. And I said, no. So I stopped taking them. And my legs started clearing up. So that just gives me my personal opinion on prescription drugs. You depend on them. You get addicted by them. You depend on them because the doctor says they're going to work. You get addicted to them by the doctor saying it's going to work, but it doesn't work. So cut the drug dependency by 50% is number 9. Number 8, help everyone get housing. If they can't afford housing, they should be able to get housing. I did a video yesterday about sleeping pods. What a wonderful way to be able to help get everybody off the street, give them a place to stay. They leave, and this next part is to give them a bag. So give everybody housing, regardless what their income is. I'm going off my notes today. Let's see. Number 7 is don't be in a rush, and don't be distracted while you're driving. Plain and simple. I see people on their phones every single day driving a car going down the freeway. I see people getting in such a dang hurry that they're flying down the freeway at 110 miles an hour, only for me to drive about 15 minutes later and their car is slammed into the Jersey barrier down the road. Don't be in a rush. I mean, car accidents, I think, is one of the most preventable thing in the United States to be able to prevent and to avoid. A lot of times, car accidents, people are being transported to the hospital because they got into a wreck. Don't be in a rush. If it's snow and ice storm, just stay at home. Be smart. So that's number 7. Number 6 is let's cut our alcohol consumption by 50%. I mean, years back when I quit drinking, I felt the effects for about one day. My body chemistry is different. And then all of a sudden I just didn't care for it. I may have a drink once in a while, but I don't crave alcohol. I don't need alcohol. A lot of people crave and need alcohol, but if everybody cut their their alcohol, down by about 50%, there'll be fewer drunk driving accidents. There will be fewer bar fights from people getting irate over alcohol. Spouse fights would drop down. Just a lot of things that alcohol fuels that, well, keep people out of the hospital. And this is the main reason for a lot of these ideas, or a lot of these things that I'm talking about, is to keep people out of the hospital. If people are out of the hospital, there's less work in the hospital, and prices got to go down. Virtual doctor visits. That's something that the hospitals have got to that hospitals have got to put together. There's virtual doctor visits. Then it cuts down waiting time. And with a virtual doctor visit, if somebody's too busy to go to the doctor, say, hey, you know what? We need to do a virtual physical. Make sure everything is ticking right. We have our doctor. We have our visit kit. We'll walk you through it. We'll get you signs, and then we'll be on our way. And from my idea from these the kits would be basically a sleeve. Would have your wires that you put on for your heart and listen to the lungs, and maybe a finger thing for another heart rate, and a thermometer that hooks up to the box that plugs into the bottom of your phone or your laptop or your tablet, so that they can be able to get your readings. The only thing that they won't be able to get is going to be your weight, which that's probably the toughest thing. But however, doctors can can coincide with people who make scales and say, hey, is there any way that we can be able to take a scale and hook it up to our med kit so they can be able to get a weight? So you put it down, you hook that up to the scale, and then you wait until the red light beeps, and then you pull it back up and get ready for your doctor visit. keeps people out of the hospital, and tries and gets a little bit of, a little bit of prevention. If somebody has a question about something like my finger's turning purple, or I have a really bad cough, or okay, you're gonna stick your tongue out, and they can be able to watch your tonsils, that sort of thing. So that's a big one. The number 4 is going to be totally eradicate tobacco. Well, they've already done a really, really good job about that. I mean, I quit smoking 6 years ago and never picked up another cigarette again. And the more that I see, the more that I look around, the more people have just abandoned tobacco. Tobacco is not a thing anymore. Somewhat. But back in the 80s, everybody smoked. So that reduces all these smoking-related diseases, but it's creating a little bit of a problem, and I'll talk about that a little bit later on because I have that on my list as well. Become more physically active. If everybody got up and went outside and walked for half an hour a day, just walked somewhere for half an hour a day, or biked for an hour a day, that will cut down doctor visits, that will cut down illnesses, that will, you're breathing better, you're keeping better care of yourself, cuts down doctor visits, stay out in the hospital. Unnecessary trips to the ER. I've watched all kinds of videos of stories from the ER of totally ridiculous things that people go and do, but a lot of it's people being ridiculous of following advice online, which gave me the idea of the virtual doctor visit. So if somebody has a problem with something, they could go online and plug up to the virtual doctor or the advice nurse that's constantly watching and waiting for people to pop up and ask questions, or even just text a message, and then they're done. So unnecessary visits to the ER. Once the ER quiets down, that's the biggest part. That's the biggest bill of the hospital. Now, number 1 on my notes on this is to cut obesity by 75% of the population. If 75% of the population dropped down below and maintained a healthy weight, health insurance will drop, because obesity-related diseases, illnesses, doctor-related visits, testing, and all that will basically rock bottom. Obesity is constantly rising because of all this body positivity stuff, but if you want body positivity, that's perfectly fine with me. But if we want our health insurance to be able to drop way down, obesity needs to drop, and obesity needs to go into a free fall. So that is my top 10 list of how medical insurance would drop. If you want to add anything to it, please leave it in the comment section below. If you like the video, please like and subscribe, like and share the video. If you're new here, please subscribe. Let your friends know. And as always, keep on rocking.